women can now test for cervical cancer at home with a self-swab HPV test. This move will give women a new way to screen for most cervical cancers without making a doctor's appointment, which often involves a painful and uncomfortable exam. So doctors hope this will motivate women to screen for cervical cancer more often. Joining us now, Teal Health's medical director, Dr. Liz Swenson, and the CEO, Egan. Ladies, thank you for being here. This is such an important topic. Kara, I'd like to start with you. So what inspired you to develop this at-home screening, and what are the accuracy levels of these at-home tests as well?
Yeah, absolutely. So as you know, and most of your women in your audience know, getting a cervical cancer screening, what we refer to as the pap smear, isn't easy. It's not easy to find an appointment. It's not easy to find time in your day. And it's also uncomfortable to use the speculum and stirrups. And so we wanted to create a way that was just much more easy for women to get screened by bringing it comfortably into the home where a woman could have privacy and confidence, to your point, in her collection. And so we ran a 16-site nationwide clinical trial where we showed we had the exact same accuracy as a sample collected at the doctor's office. So we have 96% sensitivity.
Wow, that is impressive. So Dr. Swenson, how did the test work? How do women know that they're administering this test correctly?
That's a great question. I speak with people every day about this. So they will come through our platform and answer some questions about their history. Then they meet with a member of our medical team, and we really have a short but great visit to go through their history, educate them about HPV, and go through exactly how to do the test. So we walk them through step by step to make sure they are comfortable.
Well, that's great. Gives them a jumping off point for really the rest of their lives. So, Kara, how can women get these at-home tests? Let's talk about accessibility. Also, is this as simple as heading to the local pharmacy?
Yeah, well, so it's even easier than that because, as Liz mentioned, you come to our website and you meet with our clinical team, and then we ship the kit to you. So it arrives at your doorstep. When a woman collects, she uses this Teal wand, which is very simple and easy to use. You just slide it up, there's a soft sponge, and you rotate 10 times. So the entire collection takes less than 5 minutes when doing it from home. The idea is that it should be available to everybody. Right now, if you're covered by one of the large major insurers, it's about $99, and otherwise it's $249. But what is great as we're getting more guideline changes and more reception in the market, I mean, we only came through the FDA in May, we're talking to a lot of insurance providers about getting it fully covered. So the goal is that it would be covered for all women because this is a grade A preventive screening and it should be covered. So that's the goal, and we're working closely and quickly to get that done as
well, women. That is great to hear because affordability is such a major piece of this, especially if this is something that a lot of women, you're trying to get them interested in. So that's wonderful. Dr. Swenson, let's talk about the need here. So women diagnosed with cervical cancer, this has been on the decline for the last 40 years. This is due to screenings and the HPV vaccination. But studies show actually that 20% of women are not up to date on cervical screenings. We outlined some of the barriers out of the gate. What do you believe are some of the reasons for that number?
That's a great question, yes. And we do find a variety of reasons. We ask specifically why people are choosing to come to screen with us, and we're learning that it is a combination of lack of access, lack of time, prioritizing other family members' needs before their own, wanting to avoid the discomfort of the in-person exam, and sometimes just medical constraints such as anxiety or a history of trauma that really make this a difficult exam for people in person. So presenting these patients with this opportunity is huge. They are so happy to have an alternative way to screen.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.